Hi, this is Nancy, one of the care queens with Oda Not a Care. When is it time for a patient to come off of hospice and go back to either palliative or home health care? Well, let me tell you about a patient that I have. Her name is Sandy. She's living in a bed all the time, completely bedbound, and she has been that way for a long time. She has a suprapubic catheter, and it's been a problem. And so I've spent a lot of time making sure that her catheter is functional, and we've done a lot of problem solving, and it is. She is not losing weight. She's generally happy and comfortable in the bed. I don't have to worry about any symptoms. She certainly is not going anywhere. She will live out her life in bed, in her bed. And she does have occasionally symptoms that might be UTI. Her urine gets a little bit dark. There's a little bit more sediment, no blood, but her temperature goes up to about 99.4. And her caregiver, who is so fabulous and loving, wants to, of course, keep her living as long as possible and comfortable. And so now this is the third go round on antibiotics specific for a UTI. And I've been trying to educate the caregiver that generally our goal on hospice is to provide very comfortable care during an expected decline towards death. And this patient has now been on hospice for about 5 months. And as I said, this is the third go round with an antibiotic. Clearly, her goal as a caregiver and the patient who has dementia is not able to provide what she wants, but we do have a caregiver now whose goal is to keep her alive as long as possible. And I respect that. Absolutely. I want her to do what is important for her, and in loving her patient, that is her decision, because right now there is no family. So I've just put in a call to our hospice director and said, I think at this point, third go round of antibiotics, no change in her desire to treat. If she gets a little cough, she also thinks that, let's go to antibiotics. So we will be looking at discharging Sandy from hospice care. She will go back to the other side of the fence and be taken care of by her PCP and possibly home health, for sure home health, to take care of that suprapubic catheter. So all is well, and she flunked hospice. That's the way we look at it. And we have to look at the goals. So don't be afraid to discharge your patients when they seem to not be terminal. And you have caregivers who have different goals than our hospice. Thanks so much. Watch our videos, get one of our booklets. Care is treatment.